So before we can talk about what environmental injustice is, we sort of have to have a definition of what environmental justice is. And there are a lot of definitions out there. This one is from the US EPA, and I think it's worth reading. Environmental justice, according to EPA, is the fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. That's the first part of the definition. The second is that environmental justice will be achieved when everyone enjoys the same degree of protection from environmental and health hazards and equal access to the decision-making process to have a healthy environment in which to live, learn, and work. So essentially, we have three aspects of environmental justice. One is equal protection under environmental laws, equal protection from pollution, and equal protection in decision-making. And really, it's that last piece that is key to citizen empowerment and citizen involvement in bringing about environmental justice. Historically, unfortunately, EPA's definition of what environmental justice is has not been realized for communities of color and minority community and poor communities here in Indiana and nationwide. These two photos, the first one is a playground near the BP refinery in Whiting, and then the lower photograph is in Gary, Indiana, showing a residential community right next to US Steel. So how do environmental justice situations arise? Well, they really stem from three different aspects. One is historic discrimination that has been sanctioned or was sanctioned and legal in our land use and zoning laws. The second is ongoing and current systemic inequities in environmental policy and also chronic poverty. I'd like to touch a little bit upon the aspect of historic discrimination in land use and zoning laws because it really is important to understanding why, to dispel this notion that, well, you know, this is a poor community and they just don't care. They don't care about their property values, or they could just move. You know, it's their own fault, essentially. Well, you have to go back to early in our back 100 years, essentially, to when zoning law came into effect. And the sort of premier Supreme Court decision of Euclid v. Ambler Realty is the one that legalized zoning law. And in that case, the court recognized that colored people and certain foreign races posed a nuisance to the community and reduced property values. This is a quote from that decision. The blighting of property values and the congesting of population whenever the colored or certain foreign races invade a residential section are so well known as to be within the judicial cognizance. So that was the basis of zoning law. That was a part of zoning law back in the 1920s. That very same year, the US Supreme Court passed Corrigan v. Buckley, and this case upheld the use of racially restrictive covenants. Here is some text from one of those. These are the sorts of language that would go into a housing deed to prevent people from selling to African Americans or other minorities. And it reads, "No person of any race other than the Caucasian race shall use or occupy any premises or any part thereof in said subdivision, except that this subdivision shall not prevent occupancy by domestic servants of a different race domiciled with an owner or tenant." That was illegal, not that long ago. So with these racially restrictive laws on the books after World War II, what we saw was white flight, where white left the cities for the new suburbs with the racially restrictive covenants and zoning laws in place. And they allowed legally sanctioned racial discrimination in home ownership that was also facilitated by federally guaranteed mortgages made available only to whites. So the effect was suburb expansion reserved only for middle-class white people, where blacks and minorities were relegated to a state of permanent, racially segregated rentership in urban areas, precluded from the American dream of home ownership even if they could afford it. Fortunately, that is no longer legal, but our existing laws, including our zoning laws, continue to perpetuate the problem. We have, for example, multifamily versus family zoning districts and minimum restrictions on lot and home sizes, which continue to segregate families who can't afford homes like this from those who rent or in apartments. So again, perpetuating the segregation of classes based on income levels. We also have problems, systemic inequities in our environmental laws, primarily due because of the extremely complex administrative processes that are created under environmental laws that essentially only serve those who can afford to hire lawyers or lobbyists to represent their interests, leaving out people that don't have sufficient funds or resources to take advantage of their protections. We also know, based on numerous studies, that in poor and minority communities, there is less rigorous enforcement of violations and slower and less permanent forms of cleanup. To give you a statistic there, just to put that in perspective, under RCRA, which is our solid waste law, penalties were 500% higher against polluters in white communities than in more minority communities. I have others, but I see I'm running out of time. So, just to conclude this piece, there's a complete lack of meaningful access to the legal system. One more really startling statistic, there are roughly 30,000 environmental lawyers in the United States. Of those, there are roughly 2,000 that work for government, and of the government or public interest, and within that, roughly 750 lawyers nationwide work for the public interest. So you've got a tremendous amount of inequity just in the availability of public interest lawyers. And then, of course, there's a lack of access to the political system as well because of those lack of resources. So that sort of sets the framework for our discussion today of environmental justice. And I'm now going to turn it over to Tracy to talk about a specific situation in East Chicago.
I am Tracy Lewis, Executive Director of the Minority Health Coalition, and am so pleased to be here with you today on this blustery Saturday morning. Where did our sunshine in November go? I don't know. Many thanks to Dr. Indra Frank and the Hoosier Environmental Council for the invitation and having me here today with all of you to discuss such critical issues that impact all of us and our environment. If I could ask you to indulge me for just 1 second, I want to start with a bit of an exercise. For those of you who can, I would like to ask you, if you can, if there's an empty seat next to you, either to your left or your right, I'd like to ask if you would just move 1 seat over. I believe we can trust our neighbors, nobody's going to take anything, and we're only going to be here a short time, but if I could ask you to just take a shift 1 seat over. See some folks moving here. Wonderful. 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 Thank you. I ask you to do that, and I want to say thank you for such a rigorous and thorough explanation and discussion of environmental justice. Just think about what it felt like for you to move just your chair for just a moment. How inconvenient it was, how kind of confusing it was, and how many of you in this room where there's still open seats didn't move. Imagine how people feel in communities like East Chicago when they're being asked in a very short time to uproot them and their families and move for the rest of their lives. All right, let me give you a little information about where I'm from. As I said, I'm with the Lake County Minority Health Coalition. We're out of Gary, Indiana. We serve all of Northwest Indiana, and that includes Lake and Porter County. For this special time in history, I want to emphasize that we're in Northwest Indiana because that's also known as the Illiana area, which is Illinois and Indiana together, Illiana. And for the first time in my lifetime, I can say, yay, Cubbies! 2016 World Champs! Thank you. I never know if I'll be able to say that again. The Lake County Coalition is a community-based organization begun in 1986. Our mission is to reduce and work to eliminate the health disparities experienced by racial and ethnic minorities in our counties. We're one of 23 coalitions across the state. We are an affiliate of an organization many of you might know, Indiana Minority Health Coalition, which funds us through Minority Health Initiative funds, under which numerous programs and projects have been launched and maintained to achieve the overarching goal that we have, which is health equity, eliminating health disparities, and improving health for all groups. Our vision is health parity for all. We work to achieve our vision through advocacy, awareness, and activities that result in action on behalf of and by community members. Our advocacy efforts include collaboration with local, state, and private sector stakeholders, to hold town hall meetings, to promote public policy, working with legislators, testifying at the State House, any and everything that we can do to influence systems change and legislation to improve the access to quality health care and to improve the health of all Indiana citizens. Our awareness activities include health screenings, health fairs, evidence-based health presentations, interventions, and chronic disease self-management workshops. You can see pictured one of our workshops, which is Fit Kids. It teaches our youth strategies to develop and take responsibility for their own healthy lifestyles, learning to make nutritious food choices and ways to incorporate exercise into their daily living. All of our awareness activities are designed to be actionable, to render measurable, improved health outcomes. Our Infant Mortality Community Advisory Board members collaborated to design breastfeeding mentoring. It engaged and retained 100% of all participating teen moms. 92% of those teen moms made the choice to breastfeed. In our region, where infant mortality is at its all-time highest, we rival in Lake County, third world nations, with high infant mortality rates. That is, babies that won't see their first birthday. That's not just true in Lake County. I want to say in Indiana, a state with a balanced budget, our infant mortality rate is still shamefully too high. In any case, all of our programs have pre- and post-tests that accompany the workshops and show demonstrable understanding of disease self-management, like blood pressure and body mass index self-monitoring. I want to jump specifically into the coalition and environmental justice. As I detailed to you, we work very much on the back end with the health outcomes, but as well, in particular with our advocacy efforts, we work on the front end. The rates and diseases and conditions like asthma, heart attack, stroke, diabetes, and a myriad of forms of cancer are disproportionately higher among minority residents. That's true all over, actually, the US, actually the globe, but particularly in Lake County and particularly in Indiana. African Americans and Hispanic Latino community members are impacted most poignantly. The coalition is in place to impact that reality. We believe all people share common humanity. Therefore, they have the right to equitable treatment, to support their human rights, and expect a fair allocation of community resources. We operate with the understanding that health inequities are avoidable, inequalities in health between groups. In this context, that is, within a region and in between different counties in our region, we see these avoidable health inequalities every day. We serve communities where they experience social and economic conditions and their effect on people's lives that determines the risk of illness, the actions taken to prevent them from becoming ill and/or to treat that illness once it occurs. The Centers for Disease Control indicate that health equity is achieved when every person has the opportunity to attain his or her full health potential, and no one should be disadvantaged from achieving this potential because of social position or other socially determined circumstances. Health disparities or inequities are types of unfair health differences, closely linked with social, economic, and environmental disadvantage that adversely affect groups of people. The latest and most horrifying example of this unfair health difference is sadly illustrated vividly a mere 2.5 hours drive north from here in East Chicago, Indiana. As many of you know, East Chicago's dealing with a serious lead contamination in its soil. East Chicago used to be home to many U.S. lead facilities, as well as other smelters and refineries which operated in the town for decades. Through air emissions and the burial of waste, lead got into the soil and contaminated it. Just to give a little context here, the Environmental Protection Agency, or EPA, measures lead contamination in parts per million. That's 1 part lead for every 1,000,000 parts soil. Think of it as a needle in a haystack. That would be 1 needle per 1 ton haystack. The EPA allows lead levels in the soil to reach 400 parts per million, or 400 needles per 1 ton haystack. In East Chicago, lead levels have been measured as high as 45,000 parts per million in the top 6 inches of soil. The worst of that contamination can be found at the West Calumet housing development, which was actually built, if you can believe this, with HUD funding on top of in the footprint of a copper smelter in 1976. What's also interesting is that the EPA has known about the site and its contamination for over 20 years. It's been monitoring it for over 20 years. They knew it was so contaminated in 2009, it was declared a Superfund site, which is a site where the EPA decides to devote resources to clean up the site. But even then, the cleanup had begun in fits and starts. The difference now is that today, in 2016, the levels are so dangerous that it signaled to the EPA that they had to immediately go in, begin to notify people in the city that they were going to have to begin a cleanup immediately. When the EPA gave the lead and arsenic data to city officials that the lead levels were so high and so dangerous, and in some instances, the EPA sent out letters stating that the blood levels in the soil was 60 times higher than the acceptable limit for lead and 55% higher than the limit for arsenic. This was from testing that was done in 2014, but it was only communicated to the city officials in 2016. I must commend the mayor, Mayor Anthony Copeland, in East Chicago for his quick and decisive action. Once he received that information and the EPA's recommendation to clean the site, which would actually involve going into the area and removing soil, going into people's homes to monitor and test the levels, and step by step begin to remove it. Mayor Anthony Copeland made the decision within a month to send out letters to all the residents to say, demolish the site. That is the kind of action that I believe we would want to have if it were our own situation. If someone were to say to me, Tracy, there is lead on your seat, I wouldn't want them to say, now you sit tight and I'll come up and clean it as I get the opportunity. I would want someone to say, great, take that seat out, burn it, and bury it. And that's in effect what the mayor decided to do. over 1,000 residents of the West Calumet Housing Development received letters informing them that they had to move within 60 days. Within a month, out of concern for family members, especially the children in the housing development, it was determined that instead of trying to remove the soil and clean in the homes, that that site be demolished. Now, we want to look at, actually this next slide, who's responsible. And when we look at this situation, it's easy to be shocked and bewildered and to wonder how this could happen, how it could go wrong, who's the responsible party. Having a little technology problem here. Well, I can't show it to you, but I can tell you about it. The slide actually had a number of different letters that would slide in, some from the EPA, some from Indiana State Department of Health, some from HUD. Early on, State Department of Health began in 2014 or so to send out letters to people. One of the most shocking examples is one that went to the mom listed here concerning the 2-year-old child who's listed there, who's pictured here. This 2-year-old had lead in her system measured in 2014, which was 6.6 times higher than the upper levels of concern set by the CDC. Shockingly, her mom did not receive that letter until 15 months after the testing was done. Now, the State Department of Health said, well, it's not their responsibility, that the local Department of Health was to convey the test results to patients and follow up. Well, then the city's health department turns around and points a finger back at the state, saying that the state had withdrew funding and the blood level testing in 2011. And so that led to cuts in those local programs. And it was back and forth until at the end of the day, what was understood is that the EPA sent out a letter stating that the lead levels were 66 times higher. And because that notification was not made into 2016, they bore the responsibility for what happened. In some places, tested soil was found to have 220% lead contamination and more than 130 times the arsenic contamination. So in a letter to the EPA, Mayor Anthony Copeland stated that it was the EPA Region 5. Region 5 also includes, by the way, Flint, Michigan, had created a public health crisis, and I'm receiving the sign. So I want to just say, in closing, do I have any more minutes? Not really. All right. That for what's going on here today, I think it's best to bring in someone who's actually been on the ground and in that community and can tell you more specifically what has been going on there. One of our local heroes, and certainly someone I look up to, Bishop Tavis Grant.
Thank you, Tracy. Give yourselves a round of applause. This is a great day. Come on, clap, clap, clap. I want to thank those who selected me to receive the Frontline Award. A lot of advocacy and a lot of community organizing is an unsung hero's job, and so I rushed up here to receive the award because we're doing free lead testing in my church today for persons in West Calumet. Thank you very much. I think succinctly to really look at this, because my background around the country, I'm hoping to join some of our family members and leaders concerning the pipeline in the next couple of weeks, because I think that we're going to find out, if you turned out the lights in this room, you'd find out we all look the same in the dark. And the challenge of breathing clean air and drinking clean water and having an environment that's conducive to your health and your greatest aspirations is something all of us have a vested interest in. In all that has happened so far in West Calumet, there are about 1,000 or so persons who live there, some 350 families. Only 30 of those families, just over 30 families, have been relocated. One of the challenges we've had between all of the parties that want to say it's not my fault, it's their fault, it's not the state fault, it's the federal fault, it's not the federal fault, it's the local fault, is not to fix the blame, but fix the problem. And you can relocate people, but you can't relocate the lead in their blood. In West Calumet is a high incidence of infant mortality. We have close to our family, when we moved there some 20 years ago, we have a family of mothers who have all died, but one of them from breast cancer. One of the youngest granddaughters of that same family has now gone through a double vasectomy. And so we have a generation of people who have been exposed to all of these toxins, where there are high incidence of undocumented cancer, children with disabilities, and an inadequate health care system. One of the things that we wanted before this dissent decree came out, we wanted not just relocation, but we wanted prevention and access to health care to help save lives, particularly young babies and young mothers who deserve better and the best opportunity to live a better life. And so as we're moving forward, we've had to fight on several fronts to ensure that these persons were not located in areas that would put them in harm's way. Believe it or not, many of them moved from Marion County to Lake County. Many of them moved from Cook County on the Illinois side to Lake County, seeking a better life. And having grown up in public housing, I can tell you West Calumet was kind of sort of the promised land for a while, considering what is happening in Chicago. And so we've been able to get HUD to move the relocation date back to March of 2017 to make sure people are moved the right way and in the right communities with the right resources. But having come out of this meeting, I'd like to take back home to these persons who are bewildered. My son works in Carrigosh, which is a $14 million investment. It's now an empty building. He's now working with young people and young children in the Carrigosh Elementary School that came out of West Calumet. And on a daily basis, he deals with children who are dealing with great anxiety and frustration, and parents with depression because they just don't know where they're going to end up. If you've never had to go to bed at night not knowing where you're going to live, not knowing what tomorrow's going to bring, it is a horrific feeling for a child, let alone an entire family. And so I hope that you would join us as we join you. It would be really nice to host a meeting like this in West Calumet. It would kind of colorize us up there a little bit, give us a little flavor, little flavor in our neighborhood. Yeah, bring some good to the hood. Let us treat you with some of our Lake County hospitality, because part of our challenge is to help our friends downstate in Indianapolis understand that Northwest Indiana is a part of the state. Believe it or not, when you drive all the way up to the state, you run right into Northwest Indiana. And we have some assets of air, rail, and water. And my challenge to local and federal leaders is not just relocate people, but reinvest and recapitalize and repopulate the right way, we can take a minus and turn it into a plus if we all work together. Thank you very much.
My name is Indra Frank. I'm the Director of Environmental Health for the Hoosier Environmental Council. And from our timekeeper, could you just tell me what time it currently is? And it is 11:38, okay. The situation the situations we have described for us this morning in Flint, Michigan, and in East Chicago raise the question of what the solutions are. And we need solutions both to correct what is currently wrong, where there are environmental conditions that are disproportionately hitting those of low income or in minority neighborhoods, so we need to correct what's already wrong. We also need to make sure that these situations don't happen anymore going forward. The solutions can be broken into roughly 3 categories: funding, policy, and community empowerment. And in funding, one of the things that sometimes gets forgotten is that infrastructure can also be an environmental justice issue. If repairs have been neglected in some parts of the city versus others, that needs to be brought into equity. If money invested in assets has not been distributed to the communities that need them, that can also be an environmental justice issue. And of course, cleanup takes funding. Ideally, we'd like the responsible parties to pay for cleanup. As we tell our children, if you make a mess, you have to clean it up. Fortunately, even if a responsible party has gone bankrupt, insurance companies still bear that responsibility if that party was insured. In the absence of responsible parties, there are some public funds for cleanup: brownfields grants, Superfund, and Indiana does have a small state cleanup fund. Along the lines of policy, as Kim mentioned, planning and zoning, that determines where there are residential areas, where there are industrial areas, and who's being exposed to what. That's a key area to look at for environmental justice. Eminent domain, right? This is the concept that sometimes the public good outweighs the rights of private landowners. Unfortunately, the private landowners who are rich or in political power can usually fend off eminent domain better than those who are minority or low income. That's another place to look for corrections in environmental justice. Another, as Kim mentioned, is that we need to have equity in how our existing environmental regulations are enforced, how inspectors are sent out and where they're sent out, and how permitting is done. And finally, we also need to look at our policies to ensure that they not only allow public involvement, but encourage and enable it so that the communities that are going to be impacted by an environmental action, by permitting, inspection, enforcement, et cetera, that those communities have a voice. As you know, Hoosier Environmental Council is active at the State House every year. I wanted to highlight a few of the things that happened in 2016 that overlap with environmental justice. So our legislators did adopt a study committee bill on food deserts. It's just a study committee, but the plus side is that there was serious consideration of the issue of food deserts. There was an incremental shift forward in public transportation that allowed some counties in the state to take votes on public transit. It's not big, but with these incremental changes, I think we're moving Indiana forward. One of the incremental changes from a previous year allowed the transit referendum in Marion County that came through. That's one of the few things that came through on election day. The HEC was involved in the transit coalition that really brought the voters out to make sure that we voted in favor of public transportation in Marion County. Hopefully those small incremental changes will help move the rest of the state forward. And then finally, there's the recurring No More Stringent Than bill. There was one in 2016, and we've had them year after year. No More Stringent, if it passes, would prohibit Indiana from looking at its own environmental situations and coming up with its own Indiana-based solutions. So no more stringent than would basically put the kibosh on Indiana-based solutions. In 2016, through HEC's leadership of a large coalition, we were first able to get the bill vastly improved, down to basically just a reporting bill, and then to our utter surprise, the governor actually vetoed it. Part of the reason he vetoed it is that it's on the agenda for 2017. The Indiana Manufacturers Association has already made clear that this is one of their top priorities. So join with us again. We will be leading the charge to defeat no more stringent than at the State House again in 2017 and preserve the ability to have Indiana-based solutions to Indiana's environmental problems. We will also be looking at the budget for the Indiana Department of Environmental Management. From 2007 to 2015, 25% of that budget got lost. And as you know, we can't have equitable enforcement of our laws, inspectors going into the communities that need them, and equitable permitting if we don't have the staff to cover that. There was a staff drop commensurate with that budget drop at IDEM. So for 2017, HEC is going to be involved in the budget process and work advocating for the restoration of IDEM funding. Another issue that we'll look at is the voluntary remediation program. The slide shows an investigative report out of WTHR, Dangerous Exposures, 13 investigates, reveals state program lets contamination spread. The voluntary remediation program allows a company that has contaminated a property to volunteer to assess the contamination and clean it up, and in return they get protection from legal action. Unfortunately, as the reporting found, 1 in 6 companies is failing to do the cleanup as they'd promised of the companies that are involved in that program, and that means there are dozens of sites around the state where the contamination languishes, sometimes for as long as 10 or 15 years. That's a program that needs strengthening and something that we'll be looking to during the legislative session. And finally, community empowerment. In both Flint and East Chicago, I think we have powerful examples of how people putting in the time and the effort and digging up the technical information and legal support that they need can help move issues forward. Even those who don't have a political voice because of their wealth or because of their status in society, when people join together, then they do increase their status. There are environmental justice solutions from other states that are worth looking at, and who knows, maybe some of these we could bring to Indiana. Things like dedicated environmental justice seats on planning or environmental boards, specific funds reserved for correcting environmental disparities, specific funds reserved for community assistance, assisting the communities that are trying to organize and bring in technical and legal help. Or, for example, a policy to consider equity in all future city planning, and that one comes from Cleveland, Ohio, so that even the Midwest can do things like this. So solutions for urban environmental justice issues are not easy. It involves funding, it involves policy, it involves community empowerment. We've just passed the 200 mark for Indiana as a state, and for the next 100 years, let's band together so that we can be a state where there is fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income, with respect to the development, implementation, enforcement of our environmental laws, regulations, and policies. We need a vision for our future that involves a just society. Thank you.
Okay, we'll take some questions from the audience, so make sure that you pass forward the cards and someone will come around and pick them up. The first question that we have is, how much was US EPA's action in East Chicago prompted by Flint? Anybody want to take that one? Tracy, Bishop? Is there an answer to that?
I just want to say I'm by no means an expert on what happened there, but from what I can understand and what's been widely communicated, it was based on the fact that there was ongoing testing, and with the monitoring and the results that began to come back, those lead levels were just dangerously high. And so that it's the condition of the soil in East Chicago that actually led to it. I don't know if Bishop would like to add to that.
Well, it weighed greatly because the nation was just awakened by Flint, and to just know that Region 5 includes Flint and East Chicago. Flint provided a great deal of fuel for public discourse and mobilizing and organizing, and really provided some of the additional tools that a community like East Chicago needed because of what Flint. Let's be very clear, even today in Cleveland, Ohio, they have announced that they are removing lead pipes from some 60 schools in Cleveland, Ohio. And so Flint has really been a launching pad and really enabled and empowered people in East Chicago to know what to do and how to turn rather than turn on each other, to really turn up the heat and try to get something done productively for them and their families.
Great. Next question is, are other neighborhoods near the West Calumet housing complex being tested as well? In other words, is it a much bigger problem than we believe, are being led to believe?
Yes, absolutely. There's 3 zones that they've identified. They're ranked as 1, 2, and 3, 1 being where there's the most dangerous levels, and then 2 and 3 are also dangerous, but they don't yet know who they can actually pass the cost on to, who's actually responsible. And so that leaves that area 2 and 3 kind of in a holding pattern. Bishop?
Yeah, most recently, EPA has agreed to go into the other zones. It has been our contention that the Superfund site, which covers maybe 6 city blocks, if you measure it out, should have never been divided up into zones because of the interconnectedness of the community. In one area, in one zone, there are 60 residents in a nursing home, that are surrounded by 3 to 4 hotspots. It was an easier chunk to take the housing development because it's state and federal dollars. It became more complicated in the other areas because it's residential. Regardless of that, the communities are so close together. My family lived right in Zone 2, which was right in front of Carrigosh Elementary School. The oldest senior in my church is 100 years old. She has lost her home. The second oldest senior in our church, she has lost her home. Both of their homes are in Zone 2. And so the dividing of the Superfund site really did more to hurt all of the residents, because while you can relocate some, the vast majority you leave behind with very few options.
This is a great question. What is the most effective means of advocacy for environmental justice for those of us in the dominant white middle-class culture?
Come together.
Let me just say one thing. I love the Hoosier Environmental Council's motto. All, period. Together, period. Now, period.
Couldn't have said it any better. I'm going to say to you again, we're all breathing the same air, trying to drink the same water. Many of the residents that are trying to relocate out of West Calumet are trying to come down here. I mean, you just start running out of places you can run to till you start running to each other. One of the things that we have done over and over and over again is to teach people the power of coming together. You coming together with folk in West Calumet coming together with you is a force to be contended with, is a force that a group that cannot be denied. And it has been that kind of combination in West Calumet where people outside of the community have come to see the travesty of people who well-intended. Know this, most people who move into public housing have an exit plan already. No one comes to public housing saying, you know, this is a great place to be. I'm gonna stay here for a while. I think I'll raise 3 or 4 generations here. Every person you run into in public housing has an exit plan. I'm gonna get a job and get out. I'm gonna go to school and get out. I'm gonna send my children away and get out. It is very few cases where they get put out and then relocated into another public housing community. And so you coming together and we coming together can make a whole lot happen.
How are we doing on time? Good? Excellent, 7 minutes, good. We can cover a lot of ground in 7 minutes. This is a great question, and I think this one's for you, Indra. Are you aware of any states that have programs to assist neighborhoods or communities understand and provide meaningful input during permitting or voluntary cleanups, like an environmental ombudsman or some sort of fund for technical assistance?
Yeah, the best, I can give a couple of examples. One out of New York State, where their state environmental agency actually has a grant fund, and they provide grants to community organizations that are trying to fight environmental justice. So that's one where it is an actual dedicated fund. And then when it comes to permitting, in California, their legislature actually passed a law stating that permitting for hazardous waste sites must take into account the health of the surrounding community, and that includes renewing permits for existing sites. So that's progress. It's something, those are the kinds of ideas that I would love to see us import and spread.
Yeah, I would actually add on that and make a rallying cry for folks in this room to make a really strong push to the Indiana Department of Environmental Management to adopt an environmental justice policy that doesn't just, currently it's let's just treat everyone the same. That doesn't make sense because we're not all given the same access to lobbyists and lawyers and everything else. So hopefully that's one really big action step that we could work on. The next question, I believe this would be for the bishop. How many other places of worship are helping with the East Chicago issue?
We've been extremely fortunate to broaden our coalition. There's some 20 congregations in and outside of the West Calumet area that are helping in one way or another. The past 48 hours, for example, we've been under a boil order with our water citywide, and so congregations have been providing bottled water to seniors and to those who are underprivileged in our area. I think one of the missing components in mobilizing communities is engaging your local faith, congregation, synods, temples, such, because they provide such great moral authority. And I think that's what gets lost between the conversation of public policy and legislation. What is morally right? And at the end of the day, in most instances, when we do what is morally right, we help more people in the long run rather than doing what we think is right.
So given, I think this is a very appropriate question, given our recent election results, is there any advice for all of us, given what we can glean for the pain that is happening in rural and urban communities, but also the unfortunate talk that came out of the campaign with respect to racism and disrespect for people who are vulnerable in our societies. Given that reality, do you all have any suggestions for what we can do to counteract that?
I would say even more so, we need to hold our legislators and elected officials accountable. Whoever is elected to the State House or White House or my district is now my legislator, is responsible for representation for me as well, no matter my color, no matter my religion, no matter my whatever. And I really look forward to joining together, as we mentioned earlier, all of us, to ensure that we're holding our legislators accountable for all of us, on behalf of all of us, with the frame of mind that we are our brother's keeper, and so are they as well.
Yeah. My only addition was that you're right. Whoever is elected, that's who we're dealing with, and so we persist and we continue to work and just we keep at it.
Indra, I think this is a question for you. Are there records available from routine lead screens of children at their either one-year-old checkup or well checks in Head Start programs or other sources over the past decades?
This is a tough issue. We're up against HIPAA. HIPAA is the abbreviation for the Health Information Protection Act. So the state and our county health departments can examine that data on our behalf, but they're not allowed to relinquish it. And that's, so.
All right, we'll do one more question. I think we have to wrap it up. Are there any initiatives in place to help companies who want to use humane practices and eliminate pollution that ensure economic stability will stay at a local level?
Not sure.
I would say comply with the law would be a great start. That would be the initiative, instead of trying to find the loopholes and exemptions. And if we just comply with the law, it would be a great help. Thank you on behalf of this panel. Those were some great questions and lots to think about.